What excites me is I can go in there and pretend I'm Sherlock Holmes and try and figure out what has gone wrong in this patient's brain, what's changed that accounts for the strange symptoms. And this, of course, is a lot of fun to do because you're learning a lot about the brain, learning a lot about what causes the symptoms in that particular patient. But more importantly, it's telling you about how the normal human brain works and how the activity of neurons in the normal brain gives rise to conscious experience and gives rise to the whole spectrum of abilities that we call human nature. Watch my two fingers. Do you see my two fingers?
Dr. Vilanur Ramachandran is revolutionizing our understanding of how the brain works. His efforts to solve some of the most baffling neurological mysteries take him from the hospital bed to the outer limits of brain science.
The human brain is without any doubt the most complexly organized form of matter in the universe. The brain is made up of 100 billion nerve cells or neurons. Someone has calculated that the number of possible permutations and combinations of brain activity exceeds the number of elementary particles in the universe. And this gives you some idea of the staggering complexity one is faced with in trying to understand the functions of this mysterious organ. So the question is, how do you even begin?
Ramachandran began his investigations with a strange phenomenon called phantom limb syndrome. It's not uncommon for amputees to feel the vivid presence of a missing limb long after it has gone.
After my surgery,
I sat up in the bed and still felt the arm there, still felt everything there. And I'm looking down and I'm seeing nothing. It was pretty bizarre. The more I thought about it, the more it hurt. The more it hurt, the more I thought about it. So it was like, it was never ending. I mean, I'd break out in a cold sweat and turn pale just standing here talking to you because the pain would hit so bad.
If there is any one thing about our existence that we take for granted, it's the fact that we have a body. Each of us has a body, and you give it a name, it has a bank account, and so on and so forth. But it turns out even your body is something that you construct in your mind, and this is what we call your body image. Now, of course, in my case, it's substantiated by the fact that there really is a body with bone and tissue. But the sense I have, the internal sense I have of the presence of a body and arms and all of that is, of course, constructed in my brain, and it's in my mind. And the most striking evidence for this comes from these patients who have had an amputation and continue to feel the presence of the missing hand.
Phantom sensations do not only occur in the limbs.
But in fact, you can get a phantom with almost any part of the body. You can get phantom menstrual cramps after hysterectomy. You can get phantom appendix pain even after the appendix has been removed. Theoretically, you could have a phantom of almost any part of the body, except, of course, the brain. You can't have a phantom brain by definition, because that's where we think it's all happening.
Luckily for Derek, his phantom pain has subsided. But that's not always the case. James Peacock has suffered excruciating pain since he lost his hand 6 years ago. This raises a perplexing clinical problem. How do you treat pain in a body part that's missing? James tried everything, from painkillers to hypnotism, but nothing worked.
Until I found out about the mirror box.
It was then that he came to see Ramachandran.
And one answer might be that the brain is sending signals to the arm and trying to clench it, but in you and me, there's messages going back from the muscles of the hand telling you you're clenching too much or too fast. And this damps the command signals, so you can slow down. But the patient has no feedback because he doesn't have an arm. So the brain says, send even more signals, okay? And this goes on, and you get into a sort of positive feedback loop. So I said, well, if you give him some other source of feedback, such as visual feedback, maybe that'll trick the brain into thinking that the hand is clenching or unclenching, and maybe you can interrupt this loop. So I said, well, why don't we put a mirror there and have James look inside the mirror? It's just as though you have visually resurrected the phantom limb. And of course, the patient knows it's an illusion, but it's very, very compelling.
Right now, as you look in there and you move your hand, Your phantom does the same thing as your left hand is doing. First time I got in here and I've done this, and it was just like, it relieved the phantom pain, unclenched it. You know, it was just, oh, so intriguing, you know. Sometimes it's hard to explain how you felt, you know.
Ramachandran believes the mirror box needs to be evaluated with many patients before he can be sure that it really works. But its undeniable success in uncramping James's phantom hand suggests that even pain can be a construct of the mind.